Thank you very much for this question. Let me start by informing you that His Excellency Abubakar Labaran Yusuf, during his campaign, he made promises to the state that he's going to establish 484 functional health facilities in Kano. So part of what we have done, what we adopted, is to make it a project, provide the fund, a budget line for that project. We have started with the structures that we have so far. Out of the 484, we have commenced work on over 260 now, as I'm talking to you. We are working with the local government authorities to ensure equipment of all these facilities. There is also the budget line to ensure adequate staffing. We have assessed the situation on the ground. We have seen our gaps. We have directed all the local government authorities to take note of the gaps and to come up with a proposal for recruiting this vital frontline healthcare staff, and they are doing. We have in the last 2 years admitted a student from their localities into our nursing and midwifery colleges. This is what we are doing in terms of the structure as well as the staffing of the health facilities. The MAMII project was launched in Kano for the first time. So we were able to assess our situation. We know that Kano is one of the states with a high maternal mortality. Factors associated with that include the facilities and that are so dilapidated. The lack of healthcare workforce is part of it. Then many patients or persons in the local government, they prefer to stay at home. But I think out of every 10 deliveries, you will see 7 of them occur at home. This is by choice. We're working on that. Then sometimes you find that the commodities that are required, especially essential drugs, may not be available. So we're also working on that. One, to ensure that the healthcare facilities, like I said earlier, that we have provided one functional PHC by political ward. But to say nobody will walk more than 10 kilometers without getting a functional facility where they will deliver, where they will access natal care and even repair system. We are going to have adequate staffing at the all LGS. And we are also making some conditions better for the healthcare workers, like accommodation, to ensure that wherever you find yourself a healthcare worker, you have somewhere to stay. Coming from Kano to remote LGS on a daily basis. That we're also working on it to ensure. And when you look at the transport system, which is another very, very big problem, which we discovered causes a lot of or a factor in causing mortalities in the state. We're also working on that through both the national medical and emergency obstetrics ambulance services, as well as the state. We're also providing the necessary ambulances as well as tricycles that will go into smaller places, hard-to-reach areas, to ensure that they convey mothers, especially those that are in labor, so that they go to facility and deliver there. Well, let me start by thanking you. One of the things you have done is to inform the communities about the healthcare facility services that are readily available to them. And what we have done as state is to establish accounting mechanism where we have started right from the state to the LGS, to the zones, then to the LGS, and down to the facilities and to the wards. At every level, there is a presentation from the community and as well as from the state that we are working together to ensure that whatever the state has provided to the community has been handed to the communities. And the communities are involved in maintaining the services.